Hi everybody, Mitch Leppicello here, coming to you today with more ASD topics and tips. Today's topic is suicide, and September is Suicide Awareness Month. Frankly, every month should be suicide awareness, but here we are in September, so let's talk about suicide awareness this month. And suicide awareness is, in a nutshell, about risk. How at risk is your child to think of suicidal thoughts and to act in a suicidal way? So we want to look at risk factors. And risk factors can mean stressors. Stressors in their life, from relational stressors to work and performance stressors at school or jobs. Risk factors also may include previous psychiatric disorders and mental health issues like depression and anxiety, feelings of loneliness and hopelessness. Many of those risk factors play a role in their expression and feelings that life's not worth living. And so we want to be aware of those risk factors. One of the key challenges that people with ASD have when it comes to risk factors is their communication, their expression of emotion is also challenged. So we might not get from them how they're feeling. Those thoughts of life's not worth living, life's not worth it, the profound sense of loneliness and hopelessness. We might not see that on their face, we might not see that or hear that in their communications. So we have to look in different ways, and we have to ask. So one of the parenting strategies I use in my Calm Compass is respond. And one of the reasons I like respond is that when kids are acting out behaviorally, how we can respond differently to their distress. So here's a good example how to use respond and how it might help attend to someone who might be feeling sad, down, and depressed. So children might act out without regard to other people. They might lash out and in their outburst ways when they are feeling worthless and hopeless about themselves. And if we respond just behaviorally, we might miss how they're feeling inside themselves and how they might be feeling bad about themselves. So we might want to respond with, you look like you're feeling bad about things. You look like you're not in control of your emotions and your behaviors. And we're going to get to some of those, how they're feeling better that way than we are just shutting down their behaviors. So let's use respond in a positive way to ask questions and inquire how they are feeling and thinking. Obviously, if a child does communicate anything remotely similar to, I don't like my life, I want to die, I want to kill myself, I want to kill somebody else, we need to respond appropriately, empathically, with reassurance of safety, that we will keep them safe. So one of the keys to helping kids feel safe is through supervision and action. So we might need to have them see a mental health professional, or if you're feeling like there's an imminent concern for their safety or others, then to contact 911 or take them to an emergency room for an urgent psychiatric assessment and evaluation. Aside from those urgent psychiatric assessments and evaluations at hospital or clinics, talk to your child about feeling safe and feeling okay, and the difference between feeling sad, down, and depressed and life's not worth living. We really want to make sure that life is worth living and not sad, down, depressed in a way that they want to end their life. So I'm going to leave some suicide awareness and National Suicide Hotline information on my website. and look at that and check that out if you guys need more information on that. But September is Suicide Awareness Month. Let's be aware of our children and their mental health issues in this changing new COVID school year. Be well and stay tuned for more ASD topics and tips.